Good afternoon. Thank you for joining us for this afternoon's press briefing. As you may have heard, during our state of emergency related to the coronavirus, we're going to now go to daily press briefings, and so we will be shooting for a 4 p.m. Daily press briefing. But again, thank you for the media that's here, and thanks for everybody that's watching. You all play an important role in helping us focus on facts, not fear, as we work our way through this global pandemic. I want to also start out with gratitude to thank all the people who've been involved in planning across K-12, all of our healthcare systems, dozens and dozens of state agencies, but there's been tremendous work that's happened and progress that's been made in our state with some very collaborative planning between the private sector and the public sector. So again, thanks for everybody that's working around the clock to prepare ourselves and to help protect the safety of our citizens as this emergency grows. Today, we're here as we released in a press release earlier this afternoon to discuss and share that there have been 2 additional confirmed cases of the novel, and that novel as in new coronavirus disease, also known as COVID-19, in North Dakota. The residents who tested positive, one is in Cass County, the other is in Ward County, where we had our previous positive test. That brings our total to 3 positive cases in the state of North Dakota. The individual who tested positive from Cass County is a woman in her 20s. The individual in Ward County, like our first case, is a male in his 60s. Both of these individuals have a history of recent international travel. So if there is positive news relative to the 2 new cases today, bringing our total to 3. The positive news is that these were contact travel related spread, and so we do not have yet any confirmed proof of community spread, which means that people may have been infected in the virus in the area, including some who are not sure or how or where they became infected. The public health investigation will continue as we investigate the individuals who tested positive to trace back where they might have been since the time that they returned from their international travel. So from a standpoint of the totals, in North Dakota, 223 individuals have been tested, 220 of those were negative, and as I said, the 3 are positive. From a testing capacity today, marked the largest number of tests in North Dakota for COVID-19 in a single day, with 74 tests performed today. And again, 72 of those from today were negative and 2 of those were positive. The tests have been coming in from all over the state. As of this morning, the Department of Health had tested samples from at least 21 of North Dakota's 53 counties. As we have shared in the past, as we continue to build our capacity for testing, we'll continue to see the number of positive cases rise. And we also know that, we know that testing is lagging or latent data, that the number of cases and the number of individuals that likely have COVID-19 are greater than the cases we have. And so, again, we want to, out of the preponderance of caution and out of being conservative and to protect the health of those individuals in our state who are most vulnerable, we continue to stress the importance of exercising personal responsibility as one of the best ways to reduce the spread of this potentially deadly disease, particularly for those that are elderly or who have underlying health conditions. So the personal responsibility centers around the new term that we're all learning, which is social distancing. Someone joked, and I saw a meme that said that North Dakotans had been practicing social distancing since before statehood, and that could be true. We live in one of the most rural states in the nation. This gives us some geographic advantage, but on a day like today, St. Patrick's Day, where people are celebrating the death of the patron saint of Ireland who passed away over 1,500 years ago. We tend to, as citizens, want to get together and celebrate with our friends. Again, it's part of personal responsibility. If you've traveled internationally to some area that's been infected, please stay home. If you've traveled from another part of the United States where there have been a high rate of infections, please stay home and follow the social distancing and avoid large gatherings and mass events. If you have symptoms symptoms or feel sick, please stay home. And while again, we don't have the positive test proof that we've got community spread, we can assume, based on how this has escalated rapidly in other states, including our neighboring state to the east, Minnesota, we can assume that the community spread may have already arrived. And again, to really drive home this point with data, we may think of the state of Washington as a far away and distant place. They have 943 cases in the state of Washington. It's been traced back. The original case was someone who traveled there internationally in their 30s. That individual is healthy and is fully recovered, but there's 48 deaths through yesterday in the state of Washington. I don't think anybody would want to be the person that is the carrier of this kind of deadly disease that might affect people that you don't even know. And so again, this is where personal responsibility, it's not just about your own health, but the actions you take may protect other North Dakotans. So again, well, the social distancing and what we're asking people to do in terms of their personal responsibility, stay home, don't go to work if you feel sick, practice good hygiene. We'll say it at every time we have a conference and every time in front of washing your hands, avoid touching your face. If you have a cough or a sneeze, cover it with a tissue or a cough into your sleeve as opposed to coughing into your hand. But again, the hand washing is particularly helpful. There's also, we know a lot of places that you might have taken for granted in public, whether that's ATM machines or filling up your gas tank. If you've been we know the virus can live on surfaces. And so again, washing your hands after those kinds of contacts would be really smart to do. New advice yesterday coming out of the White House: if someone in your household has tested positive for the coronavirus, it's important to keep the entire household at home, not just the person who is sick. Some of the data modeling that's been done would indicate that this is one of the strongest ways to avoid the spread of the virus is to have people who either have it or have come in direct contact with people that do to stay home. Again, part of the guidance, older individuals and those with underlying health conditions should stay away from other people however possible. Work from home when possible. Again, on Sunday, mass events and social gatherings, the limit, federal recommended limit was 50. We heard yesterday at the press conference coming out of the White House that for a 15-day period, we're trying to have a national unity effort where people can, for the next 3 weeks, try to slow the spread nationally is to avoid social gatherings of more than 10 people. There also is recommendations that people should avoid, gatherings of more than 10 people can include avoiding eating or drinking in bars, restaurants, or food courts. And as an alternative, dial ahead, pick up your food, take it for takeout, drive through, or access one of the new and emerging delivery options. People should avoid discretionary travel that is non-essential, and also social visits. Again, particularly if you've got that desire to support someone who may be at risk or vulnerable or older than you, this is a good time to give them a call, FaceTime or Skype versus a visit in person, because we know that healthy adults can be people that eventually carry this disease, even when they may not have any symptoms. Earlier, we described that we're going to have a health department hotline. That's been running all week. We've expanded the hotline hours for that. If people have questions related to that, the phones are now going to be available from 7 a.m. to 10 p.m. Daily, 7 days a week. That's moving from 5 days to 7 days and extending the evening hours from 7 p.m. to 10 p.m. And we'll have that number for you here shortly. With that, I'm going to also joined up here on stage by Lieutenant Governor Brent Sanford, who's been deeply involved in helping us drive through the planning and decision making through this, and also our state health officer, Mylyn Tufte, is going to say a few words. But again, we do have over 40 different senior leaders across the state that are working full-time across their agencies and groups and all of their staffs making this their #1 priority. Some of them are working hard, but they're not here at this press conference because they're working on continuing to build out all the plans and contingencies that we need, both through government, our whole of government approach and our whole of community approach. Next, Mylyn Tufte will offer a few remarks. I'll be back, and then we'll take a few questions. Mylyn?
Thank you, Governor Burgum, and thank you for everyone for being here. I just wanted to reiterate some points around our healthcare providers and testing. Healthcare providers are on the front line, and they should continue to use their judgment on testing. And we're asking you, from a personal responsibility standpoint, to understand the healthcare burden that you might be placing on our providers if you are doing things that aren't advised as far as going into crowds and gatherings that aren't essential. So if you're exhibiting symptoms, you should stay home. We've talked about if you're sick, stay home. If you're concerned, we need you to call your healthcare provider to go through a screening and understand if you are appropriate to get tested or if you should just stay home and do the social distancing and wait to see if you have symptoms or don't have symptoms. As the governor said, our public health hotline has increased for days and hours. That's daily, 7 to 10, 866-207-2880. And just as other things that you could do, you can look online at health.nd.gov, and there are many questions that you might have that we've already answered for lots of other people. We do want to talk to you, but we also want to use our resources in the smartest way. So if you have a question, go online and find the answers. You might find the answers on health.nd.gov. Otherwise, call us at 866-207-2880. We need to continue to work together to protect our neighbors, to protect our healthcare workers and older adults, those people that may be at high risk with those multiple chronic conditions that we've talked about. You all have a role to play in preventing the spread of COVID-19. Thank you.
Before we take questions, again, I want to just reiterate the strategy that we're working under here, and that strategy is to slow the spread. There is no, quote, cure for COVID-19. There is currently no therapeutics for COVID-19. It's fortunate that this is a virus that has lower mortality than the flu for infants, children, young adults, and healthy adults. But it's also true that, at least with available data coming in worldwide, that it has higher mortality for people that are elderly or have underlying health conditions. And so when we're taking these actions, this really is about trying to protect those that are most vulnerable in our state and our most vulnerable citizens. And this is when we talk about individual responsibility, because you could end up being young and have very mild symptoms. Most of the people that over time that may contract this may have mild symptoms. They may just stay at home and you rest at home and you go through it just like you would at the flu. Most people that get the flu don't end up being hospitalized. But just as the flu can be a killer disease, we know that COVID-19 can. And so again, the strategy here is to slow the rate of the spread. And when we slow the rate of the spread, that allows our healthcare facilities, our healthcare workers, and our capability to deliver great care for those in need at the time when they're able to do it. We don't want to end up like Italy, where you could be in a position where you have a shortage of ventilators, a shortage of hospital beds, a shortage of medical personnel. We're trying to avoid the spike by, we say, flattening out the curve. So that's the strategy, but we need everybody's help and participation to do that. We need everybody to understand that by taking personal responsibility, that they're helping to save the lives of others. And if we want to coin a new phrase that we've talked a long time about being North Dakota tough and the whole culture of being North Dakota tough. I grew up with this in Arthur. I know it. I was part of our own family, which is, you know, if you're not feeling the best, you get up and you go to work anyway. You go put in a full day's work. That's what the culture of our state has been. And we have to try to let go of that North Dakota tough for a while and try to adopt something new, which I'll call North Dakota smart. North Dakota smart is you figure out a way to protect other people by, even when you think you can make it and you can tough it out, right now make a decision that you don't. And that's going to create, you have to break habits, and it's going to create new opportunities for people to spend more time with families and loved ones. And again, I would say rather than being frustrated about a break in your normal and often hectic routine, we're empathetic that this is causing a lot of disruption for people, whether it's parents, whether it's school teachers, healthcare providers. We know that this is a unprecedented amount of disruption. But if you've got that extra time on your hand, pull out a piece of paper, make a list of all the things that you wish you had time to do, start knocking them off. And as I said last night, you know, maybe take a minute to think of somebody in your life that you can express some gratitude during this time. We get a chance to slow down, take a breath, realize all the things we have an opportunity to be grateful for in our state. And one thing you can be grateful for is, if in a worldwide pandemic, one of the places you'd like to be is North Dakota, because this is one of the last places it's arriving. And we're a state with great capabilities and great people, and we're well positioned, well prepared to work our way through this, and we'll get through there if everybody can exercise their personal responsibility. So thank you.